So our next speaker is Lisa Fitzpatrick. Lisa is the medical director at the DC Department of Healthcare Finance. Lisa has worn a whole lot of hats in her career. She's an epidemiologist, she's a physician, and she's also a health policy and finance expert. So she's probably the most credentialed person that I've ever met in my life. So Lisa's going to put all of those hats on today and tell us a little bit about how we can navigate to better outcomes in the healthcare sector. Lisa, come on up. Thanks.
Is this thing on? Oh, it's on. Thank you, Ian. I am here specifically because, and solely because I met Ian at a meeting in Oregon, and I was so thrilled at what he had to say. I cornered him after and I said, you know, the problem is people who give out money, they're not interested in investing in the things you're talking about. And he told me I was wrong. So it's really great to be here, and I can't live up to everything Ian said, but it's been a really interesting journey. And I have slides, don't I? I forgot about that. The other thing I'll tell you is I prepared remarks for this. I was also up at 1 a.m., but I wasn't reading the book. I was changing my remarks because when I read the book, I realized that I'd be preaching to the choir, because most of the things I read in the book are things that you've experienced, I've experienced, and I didn't want to come here and tell you things you already know, because I don't like that, and I'm sure you don't like that either. So there's an African proverb: if you want to go fast, go alone. If you want to go far, go together. So I've decided to tell you a little bit about what I believe is possible if we go together. But first I want to tell you just a bit about my journey. It actually starts over here. You can't see the dates, but this is 1992, so I'm probably older than I look to some of you. And I've been around the block. I've worked, as Ian said, across the health sector. If there's been a job in the health sector, I probably have done it. But the reason I'm switching jobs so frequently and so often is because I'm chasing impact. And this is how I feel most of the time, chasing impact. It has been a bit of a frustrating journey, but I'm ready to start focusing on the left-hand side. Or is that right? Yes, on the left-hand side, over here, outcomes and impact. We are very good on the right-hand side. We've heard a lot about that today. But I think part of the reason we're not so great on the left is because this side is really considered a bit idealistic. This is realistic. This is the stuff we can touch, we can feel. We're comfortable over here, but not so much over here. So I'd like to spend the rest of my time talking about what I think some of the possibilities are. What if we could do these things? That's it. Engage community, tailor services, incentivize partners, and shift culture. That's all. What do I mean by this? Engaging community. Someone's already said communication is an undervalued resource. And I think that is true no matter what we're talking about. It's certainly true in health. The average person in the community has no idea what we're spending our healthcare dollars on, or many of the programs we are implementing, they have no idea. I'll tell you a story this story happened just last week. I was running because my doctor told me I have prediabetes. I was devastated. So I decided I'm gonna run a 5K, and maybe I'll run a 10K. So I had to start training, obviously, because I don't run. So I'm walking to my friend's house after the run, and a woman walks up to me. I don't know this woman, and she says, "Didn't I see you running up on 8th Street? Why are you running so far? What's going on?" And I said, "Well, I'm training. My doctor told me I have pre-diabetes, and I don't want to be diabetic, so I have to lose weight, and I have to exercise." And she looked at me, and she said, "Pre-diabetes. Now, my doctor told me I had that. Now, what is that?" Now, the problem there is her doctor, because he's checked her for pre-diabetes, he's checked the box. So we would say he's doing what he's supposed to do. And further, she thought he was a good doctor. And I said, "Well, why do you think he's a good doctor?" "Well, 2 of my friends said he saved their lives." But still, she didn't know what pre-diabetes was or how to prevent diabetes. So we spent the next 10 minutes or so talking about diabetes and how you prevent diabetes. She wasn't engaged, but I think she's like the average Joe. So how do we improve the engagement of people in community in our sectors? Second, tailoring services. I think this is really important. It's important to me as a healthcare provider. What if we could tailor healthcare like Amazon tailors your shopping bag? Wouldn't that be great? That'd be incredible. I had a patient who didn't want to come into the clinic. So every person on my team tried to call him to get him to come in. And they said, "Dr. Fitzpatrick, we really need to get him in. He's really sick, but he's afraid to come." So I actually left the office. I called him, and I went to wherever he was. He was on the street somewhere. And we had a conversation right there on the street. I don't have the luxury of time to do that for every single person, but for him, it made a difference. So what if our healthcare and our healthcare system and our funding was flexible enough to enable that type of care? Incentives. We can incentivize our partners, and you can think about what those incentives might be for your sector. But as an example, I'll talk about doctors because that's the group I'm most intimately familiar with. Doctors care about CME, or continuing medical education, because we can't renew our licensures if we don't have it. We care about mitigating liability or vulnerabilities to malpractice. And we care about reimbursement. So if these are our incentives, why doesn't a primary care doctor make as much as a surgeon? Or why doesn't a psychiatrist or an addiction specialist make as much as a gastroenterologist? The incentives are out of whack. I'm hoping that some of you in this room, and it sounds like some of you are, in a position to initiate these conversations so that we can start to improve our incentive structure. And then finally, I just want to talk a little bit about culture, because all the things I've talked about are linked to the culture of our healthcare system, and all those things need to change. But I want to talk a little bit about 3 components. And as an example, I will talk about the budget for the National Institutes of Health. Anybody know what the budget is for the National Institutes of Health? $32 billion. That's annual. It's been increasing, but right now it's about $32 billion. Related to my remarks about communication and educating the community, most people in the public have no idea what NIH does. This is a culture we've created. I'm a fan of science. I've been a researcher. I value data. But at the same time, NIH is funded by, and I'm using them only as an example, NIH is funded by taxpayers. The currency in academia is manuscripts, publications. Some of you already know this. What if, Every time an NIH-funded grantee published a manuscript in a scientific journal or a peer-reviewed journal, they were required to also publish something for the community describing their research or their science or how it impacts the community. I tweeted Francis Collins about this. He didn't write me back. But maybe if you think it's important, you can help me as well. The second thing is we need to train our workforce. The students who are being trained right now, they're not all being trained to deliver the type of care I'm talking about or to think in the ways I'm talking about. And then finally, I think we have to ask consumers. We have to talk to them about what we're doing. Ask for their advice if we're planning to implement a new program. Is this what people want? Is this what people need? So there's another saying, if you've traveled down a wrong road, turn back. We are speeding down this road in our silos. And the silos are frustrating, but they're also comfortable. So are you ready? Are you ready to change? If you're a decision maker, how important is it to be first or to get the credit? Or if you're a funder, are you ready to take a bigger risk with even less evidence or less data? When I was a girl, my mother would often have me sweep, and I hate to sweep. So I would do a lackluster job sweeping, and she would say, Lisa, don't half do it. If you're gonna do it right. In other words, she was saying, do it full out. I think we've been half doing healthcare and health services up to now. So if you're ready, let's go together and do it full out. Thank you.